I get called quite a bit when I'm working charge in the ICU to come assist with NG tube placements. And so these are some of the common mistakes I see nurses make when they are trying to place an NG tube. The first thing is when you are placing an NG tube, a lot of people want to aim your NG tube. This is my bendy straw, by the way. I don't have an NG tube at home. They try to aim upwards for placing the tube, when in reality, you want to kind of aim more back. Your nasal passages aren't up in your brain, okay? They're not up here. It's more a back motion. The majority of patients in the ICU in general aren't typically alert and oriented or able to easily follow commands for a procedure like an NG tube placement. And so a lot of people are like, my patient won't swallow. I don't know how to get it down, the esophagus without going down into the patient's trachea. So my favorite thing to do is once you actually place that NG tube back and you're kind of sitting right there in the back of the patient's throat, I will wait for the patient to swallow, whether they can do it on command or just eventually they're gonna swallow. If not, I will sometimes take just like a damp, moist swab and put it in their mouth and give them something to kind of suck on. And I will wait for that swallowing motion to start advancing the tube a little more. The most uncomfortable part of an NG tube placement is when it's going in the nose and when it's hitting the back of the throat. Once you are down into the patient's esophagus and advancing down into the stomach, it's usually not as uncomfortable for patients. I also, the other day, had a patient that was really anxious over an NG tube placement. And so I actually got the okay to use like a Eurojet, so like lubricating lidocaine gel that you could use for like a Foley placement. But I used it for my NG tube placement. Honestly, 12 out of 10 would recommend. I just like kind of injected some up into the patient's nose and let it sit for a minute or two. And then I also lubricated the NG tube with it as well. Lube is your friend. You definitely want to have your tip nice and lubricated, especially when you're passing it through the nasal passageways. Sometimes there's some gunk and debris built up in there, and this just helps smooth things out. I also want to add that if you have a patient that's like really fighting you for your NG tube placement, you don't have to force things. Go nice and slow, even if you just get a little bit in at a time and give your patient a chance to kind of settle down in between each movement. It helps a lot and it makes it just easier for you and for them. Another thing that really helps is if your patient can, have them tuck their chin, especially once you get that tube back down near the patient's throat. Have them tuck their chin, and that helps with getting it down into the right spot. But remember, if your patient ever starts coughing or desatting or in any sort of respiratory distress, pull that NG tube out. When in doubt, pull it out. Last thing we want is to put it down into the patient's airway. And those are just a couple little tips here and there. Let me know if you'd like some more, because I could talk about NG tubes all day.